Hello, everyone. Thank you for joining today's webinar, The Cost of Inaction, Expensive Health Harms of Climate-Sensitive Events. My name is Kara Cook, and I'm the Climate and Health Program Manager for the Alliance of Nurses for Healthy Environments. First, I want to take a moment to acknowledge the unprecedented time we are in. I want to thank those who are on the front lines caring for those impacted by COVID-19 and those of you who are responding to the pandemic to ensure that others are safe. I also want to acknowledge the healthcare workers we have lost and those of you that have lost loved ones. Annie is here to be of support to you all and to offer a place of community during this time. With the urgency of COVID-19, we know that challenges such as climate change have not gone away, and therefore we're going to continue to offer opportunities to engage in discussions about how we build towards a healthier, safer, and more just future through addressing the pandemic and climate change in tandem rather than as distinctly separate issues. So we thank you for joining us today. This webinar is hosted by Annie's Global Nurses Climate Change Committee. On the webinar, we'll hear more about the human health related costs of climate sensitive events in the United States. Before we get started, I just have a few housekeeping items. We'll take questions at the end of the presentation. Dr. Adrienne Wald, who is one of the co-chairs of the Climate Change Committee, will be managing the Q&A at the end. To enter a question, you can enter a question at any time during or after the presentation by entering it in the chat box, which is on the bottom left-hand corner of your screen. This webinar is being recorded and a link will be sent out to the Climate Change Committee listserv and to those who registered for the webinar. We are also offering one nursing CE for this webinar, and you will get a link to the post-test and the evaluation that you need to complete in order to receive that CE. With that, I'd like to introduce our speaker for today's webinar, Dr. Vijay Limaye. Dr. Limaye is an environmental health scientist at the Natural Resources Defense Council. He is broadly interested in addressing international environmental health challenges, quantifying, communicating, and mitigating the risk associated with climate change, with a focus on the public health burden of air pollution and extreme heat events. Prior to his role at NRDC, Dr. Limaye worked for 3 years as a scientist at the U.S. Environmental Protection Agency regional offices in San Francisco and Chicago, focusing on Clean Air Act regulatory implementation, risk communication, citizen science, and air quality monitoring policy. Dr. Limaye, who also speaks Spanish and Hindi, has conducted interdisciplinary research quantifying the health impacts of climate change-triggered air pollution and heat waves for populations in the US and India. He holds a bachelor's degree from the University of California, Berkeley, and a PhD in environmental epidemiology from the University of Wisconsin-Madison. So with that, I'll turn it over to you, Dr. Limaye.
Great, thank you. Appreciate that kind introduction. And first, just want to acknowledge all of you and offer my words of thanks for all of your work and for making a bit of time for this presentation today. Given everything that's going on in the world, I'm really grateful for all of the nurses in my life, a few in my family, and I'm just very happy to share some of this work with you today, and hopefully we'll have plenty of time for Q&A. So as Kara said, I'm a scientist with NRDC. We're a big environmental advocacy group based in New York City. We are one of the oldest environmental and public health advocacy groups, turning 50 this year. And we're really a team of lawyers, scientists, policy advocates working on environmental protection and human health. A lot of our focus is in the United States, but we also have a pretty robust international program, and I do quite a work with our India team. So very happy to share some of our work on climate and health costs today, and happy to chat with you after the talk about some of our other work in this space. So just want to offer some sort of big picture thoughts before getting into the details of this work. And I don't think it's lost on anyone on this call, certainly, that climate change is not a distant, abstract threat, but rather a threat to public health here and now. Certainly, the last couple of years have demonstrated in a pretty visceral way the many ways in which our world is now in a disrupted state in terms of the climate. We are facing unprecedented risks when it comes to climate change triggered exposures. So anything from California's, most widespread, deadliest wildfire seasons in recent years to historic flooding in the Midwest. There have been no shortage of recent examples of extreme weather and really profoundly disruptive risks to human health in this country and around the world. Despite all of the evidence about climate change and health, I think for me as a scientist, it's kind of rare to see all of the climate change related health risks presented in one place. We hear a lot about one impact or the other, but when you have a look at a figure like this, which was first published more than 20 years ago by my PhD advisor, Jonathan Patz, who is a medical doctor and really a pioneer in the space of climate and health, this figure really spells out, and this is even just a sample of the ways in which environmental changes, particularly temperature rise, sea level rise, and changes in hydrologic patterns or the water cycle, can really trigger some profoundly dangerous health impacts for populations around the world, including here in the United States. I focus quite a bit on air pollution and extreme heat, which are really strongly linked to a changing climate, but there's a whole host of other adverse health responses that researchers are worried about, and a lot of those are spelled out here. When it comes to vector-borne disease, the United States has certainly seen an expansion of Lyme disease in the Midwest, upper Midwest, and the Northeast, as well as outbreaks of vector-borne diseases like West Nile virus. We've also seen impacts from waterborne disease, including cryptosporidium, and a link to cholera outbreaks, especially in South Asia, and disruption in where people can live and the issue of environmental refugees. So this issue of climate and health is really one in which the science is strong and growing. But despite that, it might surprise you to know that of all the climate research that's been happening in the peer-reviewed space, the Lancet Countdown recently estimated that only about 1% of the published research actually focuses on the human health burden of climate change. So while this is sort of the air that I breathe and the water that I drink every day at work, it's not lost on me that out in the public mind, climate change isn't necessarily seen as a public health issue. It's more often seen as something connected to, you know, energy supplies or engineering challenges. But oftentimes in the public health space, we haven't done as good of a job of making this problem seem more local and more real to people in terms of something that they really care about, their health. So that's what really kind of motivates this project that I'm going to tell you about today. I want to draw attention to the economic impacts of climate change when it comes to the fourth National Climate Assessment, which was published just after Thanksgiving in 2018. That really big synthesis report from our federal government, all of the federal agencies collaborating to describe the state of climate impact science in the United States, drew big headlines, front page news in the New York Times, pointing to huge risks for our gross domestic product related to climate change damages. And what this National Climate Assessment pointed out was that we really face hundreds of billions of dollars in economic risks related to this problem, especially if we fail to get a handle on it. And so I would just point to this resource available online, the National Climate Assessment. Many of you are probably already familiar with it, but for me, it's an extremely useful synthesis document that really highlights the best available science when it comes to climate change and public health. In terms of what we've seen recently around this country, I want to point out an effort by a federal agency, NOAA, the National Oceanic and Atmospheric Administration, which tracks what are called the billion-dollar weather and climate disasters around the country. So this is basically our federal government's best estimate of the most expensive climate and weather disasters that hit the country day after day, year after year. NOAA has been tracking these impacts since 1980, actually, and publishes a quarterly estimate, an update to this billion-dollar weather and climate disaster list. And what they're doing is basically tracking damages to property, crops, and infrastructure, things that are insured or repaired and have relatively easy methods of attaching dollar figures to them. And so you can actually visit NOAA's website, and this is an example of all the weather and climate disasters that hit the US last year in 2019. And a number of these, including wildfires out west in California, as well as historic flooding in the Midwest, are linked to a changing climate. Some of them, however, are not. So their science is still not quite settled on tornado risk, although we're learning more about the potential link to climate. And so this type of compendium really gives us a sense of how things have been changing in our country at a sort of high level over a relatively long period. When we look at the trends of those billion-dollar disaster lists over the last 40 years, we see a pretty stark increase. And so this bar chart here kind of disaggregates all of those weather and climate disasters to different types of impacts. So each colored bar corresponds to a different price tag, all adjusted to 2019 dollars. When you actually look at the details of those numbers laid out here by Adam Smith, a scientist at NOAA, you can see that whether you choose a range of metrics here, we've seen that these weather and climate disasters are becoming more expensive. So the number of billion-dollar disasters has increased significantly since 1980. The costs associated with those disasters has increased by quite a bit. And as you can see, the number of deaths associated with these weather and climate disasters has increased quite a bit since 1980 as well. And so this information really shouldn't, surprise most of us, given what we know about the science of climate change. But unfortunately, the numbers presented here only present part of the picture in terms of the very real damage inflicted by climate-sensitive events. The take-home question from a chart like that for me is what's left out of it. And unfortunately, when it comes to our federal assessments and really public understanding of climate change, we very much lack any robust understanding of actually how much climate change costs in terms of our health. We really have no systematic way right now to put a price tag on those impacts. And so that's really the question that motivated our overall work. So when we think about the billion-dollar disaster list, that list, unfortunately, is only counting things that are insured or repaired. So like I mentioned, property, infrastructure damage, or crop failure. And as a result, we've seen that health costs have been basically sidelined from estimates of climate risks, despite all of the evidence in terms of the relationship between climate change and public health impacts. That absence is due to a number of key factors. We lack the data sources and integration of those data sources. And basically, we've seen that health costs have been valued at extremely low rates historically. And so we're working from we're trying to catch up in terms of fully accounting for these health costs when we think about the range of climate-related risks. But in order to sort of surmount this problem, NRDC has been working for a while, really since about 2011, to undertake an effort using basically recent case studies of climate-sensitive events as the basis for predicting the scale of financial impact associated with potential future events. And that's really what motivated our work. There was a study that NRDC led in 2011 that I'm happy to share with all of you. And really, my work was aimed at updating and expanding that analysis. So the work that I'm going to describe for really the rest of this talk, I just want to note up top that it was published last fall in the open access journal GeoHealth. The full citation's here, and I'm happy to share the PDF of the article after this talk. It's free to access, and GeoHealth is actually a really emerging voice in the climate and health space and environmental public health space that you might find interesting based on your focus on environment and health. I encourage you to check out that journal. It's becoming, I think, more of a hub for this type of work. Anyway, so this case study, the approach that we undertook really focused on selecting a number of case study events, really spanning the entire range of climate-related health harms that we could get our data on, arms around. So looking at that figure from the start of the talk in terms of all the science that tells us about the strong links between climate change and extreme heat, air pollution, wildfire risks, et cetera, et cetera. What we did is really select our case study events all from a single year. We ended up focusing on the year 2012 and utilized publicly available data sets to characterize health outcomes quantified at the state level. So those were in scientific journals or other public data sources like state public health reports. And then we used federal health cost databases and statistics derived from those systems to come up with ultimate price tag estimates of the health-related costs of these climate-sensitive events. So here we're talking about the burden of both morbidity and mortality. Historically, a lot of the focus when it comes to climate change and health has been on mortality burdens because those are relatively easier to model and calculate. But unfortunately, that means that there's been a hugely neglected morbidity burden associated with climate-sensitive events that we really wanted to eliminate through this work. So this map here really gives you a sense of the scope of our analysis. And each icon here highlights one of our state-level case studies that we focused on in this research. So you can see here that we're talking about a wide range of climate-related health harms, everything from wildfires in Washington State and Colorado to extreme heat in my home state, Wisconsin, and the vector-borne infectious disease, Lyme disease in Michigan. We also looked at Hurricane Sandy's impacts in New Jersey and New York, as well as the impacts of allergenic oak pollen and the lengthening of the pollen season in North Carolina. So you can see all the case studies sort of laid out here, and I want to just say that we tried to represent quite a bit of variability in selecting these case studies. Our primary concern was identifying case studies for which we had available data, and that really constrained us because right now, like I said at the top of the talk, we really lack an integrated national system for tracking climate-related health harms. I think the current pandemic situation has really shined some needed light on the lack of investment in our country in public health preparedness, and certainly that extends to environmental public health and tracking and surveillance. And so we were really working from publicly available data sets to arrive at this set of case studies. So we try to represent a range of geographic variability when it comes to these case studies, spanning almost coast to coast. We had focused quite a bit on California in the prior study, so we didn't do a case study there this time. But there was also a range in severity of the case study. So we knew that Hurricane Sandy, for example, accounted for the vast majority of mortality related to hurricanes in 2012. Whereas the impacts of air pollution in Nevada, for example, were about on par for that state historically. So we wanted to represent, sort of a range in the severity of each case study so that we could characterize events that sort of fell within that range from sort of moderate to severe, so that we weren't cherry picking our case studies to represent just the worst case scenario across the country. So it was this case study set that really sort of constrained the rest of our analysis. And again, we used a bunch of data sources. This is one of the tables in the paper that just points to our current predicament, right? So at this point, we utilized about 36 data sources, all of them publicly available, but none of them in one central clearinghouse, to characterize the health effects, morbidity, and mortality arising from each of those climate-sensitive exposures. So we leaned quite a bit on the peer-reviewed literature, environmental epidemiology, connecting specific exposure events to hospitalizations, emergency department visits, and deaths. But we also relied quite a bit on data collected at the state and federal level, including partners at the Centers for Disease Control and Prevention, the Environmental Protection Agency, where I used to work, and NOAA. So we were taking advantage of publicly available data basically wherever we could find it, as long as it was vetted to some degree. But really, this table to me is a little bit of a warning sign because it tells me that we lack an integrated system for really tracking climate-related health harms across this country. And certainly we know that when we don't have data, we can't make informed decisions and we can't efficiently allocate limited resources. And so this data problem, I think, is certainly central to this work and some of our policy recommendations towards the end. So when it comes to our methods for estimating the health costs, we wanted to take a pretty expansive view of what was actually impacting folks on the ground. Many times when we think about health harms related to climate change, we leap to mortality, as I mentioned, but also when we think about morbidity, a lot of studies just sort of stop at characterizing ER visits or hospitalizations. And that makes sense, just given the limits of access to data. But we wanted to have a fuller sense in this study of what actually happens when folks are in the hospital. Are they spending multiple days away from their job and potentially losing days and days of wages while they're undergoing care? And do they require ongoing care after they're discharged from a hospital, whether it's outpatient care needs or home health care aid or prescribed medications? And so here I just want to acknowledge really the awesome federal healthcare statistics databases developed by the Agency for Healthcare Research and Quality, AHRQ. Those databases were extraordinarily useful for us in attaching costs to the health impacts that we had identified. And so I think this also points to an area where all of you have much more expertise than I do in terms of the utility of tracking ICD codes and patient codes when it comes to making efficient use of the data and medical records. So I'm extraordinarily grateful that we had access to all of this, wealth of information, and I think it really points to the need for robust investments in medical records and efficient ways of connecting systems so that we can actually understand what's happening on the ground. So this is kind of the wonky view of the methods. That's just a figure from the paper. But basically, the take home from this figure is that we relied on a whole range of data sources to construct our ultimate estimate of health-related costs from these case studies. So the yellow boxes here basically represent all of that input health data, those couple dozen sources that we relied upon to just estimate morbidity and mortality across the country. Those healthcare cost databases are represented here mostly in the blue boxes, and these really point to our method of trying to estimate the costs associated with hospital admissions and emergency department visits. So here we're talking about using the available data at the federal level to do some imputation. So in some instances, we had estimates of the number of folks admitted to the hospital, but we did not have a corresponding estimate of emergency department visits. And so we used those databases to do some extrapolation based on the available data and historical trends. In terms of attaching a price tag to premature mortality, sometimes folks have questions about that. Our federal government currently endorses this value of a statistical life approach, VSL, which is actually kind of a way of characterizing the economic ramifications of premature mortality in terms of what folks are attaching in terms of a dollar value in willingness to pay economic studies. And so we just basically use the same metric that EPA has applied in recent regulatory impact analyses, just so that we would have an apples to apples comparison. On that note, we applied the same national healthcare cost averages to each state case study so that we could allow for some state versus state comparisons, although those databases to some extent include state-specific data, so that would allow us to drill down at a more granular level if those questions were of interest. So when it comes to the health impacts that we identified in these case studies, they were pretty striking. So overall, we identified more than 900 deaths, 20,000 hospitalizations, and nearly 18,000 emergency department visits just associated with this set of case studies alone. And I think that's sort of important to consider, just because oftentimes we will see, in the public mind and in the media, we'll see, reporting about Hurricane Sandy or reporting about a wildfire, but oftentimes it's a very piecemeal accounting of the actual human health outcomes from these events. Certainly, we do not see a cumulative, sustained attention towards the long-term burden of these events. And in some states, like in New Jersey and New York, we identified a mortality burden that was significantly higher than what's publicly appreciated in terms of the ultimate impact of that storm, for example. So certainly, while we see quite a bit of variation in this table, for example, no deaths associated with Lyme disease or harmful algal blooms, I think overall the take home from this chart is that right now we're seeing pretty high levels of morbidity and mortality, all related to environmental public health. And I don't think it's widely appreciated that each of these problems on this chart is expected to worsen in one way or another in the future due to climate change. So when we think about the present day burden and our dysfunctional health insurance and healthcare access in this country, it's certainly a worrying sign when we think about what could be coming our way based on the modeling. When it comes to the specific health effects that we identified, I did want to highlight this kind of grim table from the paper, which really points to the wide umbrella of health effects that fell under our analysis. So we categorized health effects and health costs by ICD code. And so that really allowed us to characterize a pretty wide range of diagnoses in each of these case studies. I've been working on this issue for a while, but it still struck me that, in some of these states, there were some impacts that I hadn't anticipated. So for example, we saw quite a bit of a health burden associated with wildfires in Colorado and Washington. A lot of those impacts were associated with wildfire smoke, which is actually sort of named lately as a reason for declining air quality in the United States. In the last 3 years, we've seen a measurable uptake in what's called fine particulate matter air pollution. It's the deadliest form of soot air pollution that's basically comprised of these really microscopic particles that can penetrate deep into the lungs. And unfortunately, that wildfire smoke spreads far beyond the area of the fire itself. NRDC has done work showing that wildfire smoke can actually travel hundreds of miles downwind and impact millions of Americans. So when we all, see the news out of California and see the wildfires, I think sometimes it might, trigger a sense of comfort that maybe we're on another part of the country. But unfortunately, folks in California are experiencing really high smoke exposures, and that smoke is traveling far downwind and impacting states far away. So it's important to consider the cumulative burden of these events far beyond the original site. On the same trend, I think when it comes to Hurricane Sandy, we identified a study from 2018 that characterized pregnancy complications from that storm, and I think that's the type of impact that isn't widely appreciated as sort of a long-term adverse outcome from the storm itself. So I think a table like this really tells us that we have a whole lot of reasons to act fast to address the climate crisis, because even this grim list is really only a sample of what we know is coming due to climate change. So whether it's homelessness from Hurricane Sandy or asthma attacks that are worsened by extremely hot weather and ozone air pollution in Nevada, we know that we've got a lot of health risks coming our way due to climate change, and that in many cases, these health impacts are actually going to cascade and kind of overlap with one another. So while each of our case studies here was really sort of a siloed analysis in each state, we know that these places are experiencing, sequential burdens and sometimes overlapping burdens of climate-related events into the future. I mentioned some of the wide array of health problems in the last slide, so I won't stress this one too much, but I'll just point out that we relied on some new science out of the Environmental Protection Agency when it comes to the wildfire smoke and health analysis. And I also just want to point to the need for planning to allow for sustained care in some of these situations. So for example, in Hurricane Sandy, we identified quite a few extra deaths from disruption in kidney care, end-stage renal disease, and dialysis that were identified mostly in New Jersey and New York. And so that really points, I think, to the need for more integrated, robust planning for keeping operations running smoothly so that folks dealing with chronic disease can continue to receive care even under some pretty trying circumstances. I see we're half past, so I'll wrap up with about 10 more minutes, and then we can get into Q&A. This figure here, this chart really spells out the take-home message in terms of these health costs associated with climate-sensitive events. What we end up with when we add up all the price tags from each case study here is basically a $10 billion impact from just these case studies alone in 2012. That $10 billion is broken down into the morbidity and mortality burden. So by far, the majority of the price tag is associated with the premature deaths. Those more than 900 deaths across the case studies. But there is also more than $1.5 billion associated with expensive medical care across all the case studies. And so, one might ask, compared to that $1 billion disaster estimate for 2012, what does $10 billion in health damages really mean? And our federal government estimated about $40 billion in climate and weather disaster damages due to non-human health impacts in 2012. So $10 billion, and remember that's just a sampling of the states, represents itself just like a 25% bump in the overall national price tag that year associated with climate and weather disasters. So this is a really worrying signal when we think about all of these missing costs that right now aren't a part of our policymaking and our understanding of the huge financial burden when it comes to human health, climate change. It's worth asking, who's paying those billions of dollars? And fortunately, the Healthcare Cost and Utilization Project, one of those healthcare databases that we relied on, allows us to basically pinpoint the expected payer of the morbidity costs, the illness costs. And what we found was pretty striking. We found that a disproportionate share of the illness costs were shouldered by Medicare and Medicaid patients. So those patients were were disproportionately overrepresented when it came to payers and their representation on the population basis. But that finding really aligns with our scientific understanding that older adults and the economically disadvantaged are among the most vulnerable communities to the health effects of climate change. And so this really points to the need to bolster our health systems, including our insurance mechanisms, to account for heightened risks in those communities. Certainly, the current situation is also pointing to the existing health inequities in this country that are exacerbating risk for particular communities. So I think that was an important finding from us to really point to the ways in which climate change is going to exacerbate existing environmental health disparities. So when it comes to what to do with this information that we're shouldering billions of dollars in health-related costs, we identified really four key policy recommendations from this work. First of all, it's just about reducing climate change, mitigation. We know that addressing the root of the problem, fossil fuel pollution, will allow us to reduce climate-related health harms and in the process save billions and billions of dollars into the future. And that really has to be, I think, priority number one. At the same time, though, we have to prioritize adaptation and preparedness in communities, because we know at this point that we have baked in a fair amount of unavoidable damage to communities. And so we really need to invest in climate change adaptation in a targeted way, given limited resources, and show that those limited resources are well spent, that investments in heat early warning systems, for example, are extremely cost effective in terms of reducing damage to human health that's really expensive. And so we're interested in demonstrating how these adaptation interventions are smart investments and explaining that to policymakers who are faced with decisions about how much money to invest on the climate space. I've been talking about data and tracking for much of this talk, and it probably won't surprise you that we recommended a need for really more improved surveillance and tracking when it comes to this problem. We need to better understand what's happening on the ground. We need the CDC to work more with our state and local public health departments when it comes to climate change. Certainly CDC is stressed at the moment, but they've also been stressed for years and years when it comes to their climate and health program in terms of underinvestment from the federal government. And so we've identified some ways in which an improved tracking network could really allow us to better characterize the overall situation of what's happening across the country and help to make the case for expanded ambition on the climate crisis. And then the last recommendation is really around these cost estimates. You know, when a IPCC report or a big national climate assessment comes out for the US, those reports should include health damages front and center. We have shown through this work, and many have shown through other research, that climate change is an extraordinarily damaging problem when it comes to human health, and it's very expensive. And so right now, these studies are largely limited to the peer-reviewed academic literature, but we really need them to infuse these big assessments that make a lot of headlines and get a lot of attention from policymakers in order to draw attention to the very real cost that people are paying right now to deal with climate-related harm. I would also just mention that a metric like the social cost of carbon, which is kind of a wonky term, but it's an important metric used to characterize the externalities and the damages associated with ongoing climate change to society. That type of metric really does need to more robustly capture human health damages. Right now, it really only accounts for some of the health harms that we know about, like extreme heat. But a study like ours, I think, lends evidence to the need and urgency to the need to update the social cost of carbon to really demonstrate that climate change isn't just extreme heat, it's not just air pollution, it's not just wildfires, it's all of them and much more, and it's very costly. When it comes to the overall fabric, I just want to point out the last figure that we published in the paper, which is really pointing to kind of trying to extrapolate from these case studies to the situation nationally. So on this bar chart, all of the blue bars correspond to the burden on human health associated with each of our case studies. So for example, way over on the right, that blue bar at more than 95%, shows you that Hurricane Sandy really accounted for the vast majority of health impacts associated with hurricanes in 2012, to the best of our understanding, given the available data. In contrast, for problems like Lyme disease or extreme heat or ozone air pollution, we accounted for less than 5% of the documented national health impacts of those exposures. And so it's really a figure like this that gives us some understanding that the $10 billion in health-related harms we identified really correspond to likely multiple hundreds of billions of dollars across the country. When you extrapolate from our price tag and using the available data, you really end up with hundreds of billions of dollars just in 2012 associated with climate-sensitive health harms. And so it's that extrapolation that really points to this big challenge in our space, which is trying to estimate the overall fabric of what's happening across the country and really around the world. And so given our lack of access to high quality data at a consistent scale, we really lack the ability to do that at the moment. We also, I think, are seeing the attribution science in terms of statistically connecting cause and effect from climate change to these harms. It's catching up, but it's still not rapid enough to match up with the health impact estimates in the research space. And so the overall challenge here is really to use a case study analysis like ours and many others to connect it to the overall fabric of potentially hundreds of future heat waves, droughts, storms, et cetera, and understand what the overall scope of the problem is. I would also just mention that this study wasn't itself a climate change attribution study. So we did not statistically attribute the heat wave that Wisconsin has experienced in 2012 to climate change. I'm not an attribution scientist, so I wouldn't have been well equipped to execute such an analysis. But really what we were hoping to do was use present day case studies to sort of better bound the overall problem. Just to sort of wrap up my talk before taking some Q&A, I just want to, give us a little bit of hope, because some of this stuff is fairly grim, especially given the current situation. This is a picture of New York City in 1966, 4 years before the Clean Air Act was passed. And I live in New York, and this picture is, unrecognizable to me. And it really points to the huge progress we've made on Clean Air Act protections. That law turns 50 this year, and EPA itself has estimated that the health benefits in economic terms exceed the costs by more than 30 to 1. So we're talking about $2 trillion in health benefits achieved by the American public. And extension of life expectancy by about 2 years thanks to clean air protections. What I think we need to do is tell a similar story about climate change and how action on the climate crisis could really allow us to save many hundreds, thousands, probably millions of lives and billions of dollars year after year if we act fast and act smart. I think there's a reason to believe that the economic argument might activate a new portion of society that really hasn't been energetic on this problem to date. To that end, our study motivated a lot of good local coverage last fall, and we were very heartened to see these stories and others like them really focusing on the backyard impacts that people are experiencing related to the environment. I think a lot of folks think about climate change as a problem that's really hard to wrap our heads around, and when we talk about local impacts and what's actually happening in our area, it can make it sort of a bridge to understanding the science and its importance for public policy. Our president, former EPA Administrator Gina McCarthy, had a chance to feature this work and related topics at a hearing of the House Select Committee on the climate crisis in February. And she pointed to the economic arguments as a way to activate potentially a new segment of America that thus far has been stubbornly resistant of government action on the climate crisis. The last thing I would just point to on these slides is some of our climate change and health maps at NRDC. I'll just point you to this URL on this slide, which really points you to a portal we've been developing to try to make climate change more of a local story and allow people to zoom into their community. This is an air quality map, for example, and allow them to understand just the unprecedented trends that we see around the country when it comes to ozone or air pollution or other climate-related health harms. So we're really trying to make climate change a local story in as many ways as we can, including developing some state-level synthesis reports, really identifying what the science tells us about what climate change means for particular states. And so the link on this slide can point you to some of those issue briefs. And then lastly, I would just point you to a commentary that I had a chance to publish with a couple of colleagues at the University of Wisconsin-Madison in JAMA at the end of February. And this really points to this economic argument when it comes to human health and climate change. It's a pretty brief commentary, but it identifies a lot of the same content, but across other sectors when it comes to health, including energy production, food, and our transportation systems. So with that, I am very eager to take your questions. This is my contact information. I'm happy to take questions now or later over email. I also blog pretty regularly on climate and health topics and federal science policy when it comes to air pollution especially. And then I'm also pretty active on Twitter. So happy to chat with you now and into the future. Thanks.
Well, this is Adrienne speaking, Adrienne Wald, and I just wanted to take this opportunity to welcome everyone. I see we have a nice list of attendees here. I want to thank Dr. Limaye for doing such a wonderful presentation on such an important topic, really shedding light on the economic story that goes along with these climate-related, the burden of climate change, and the importance of the really underappreciated aspects that we're talking about here in terms of the health costs that I think make a really compelling case for political action and change. And so we thank you very much for spending this time with us. I had the pleasure of hearing this presentation at APHA in November, and it was met with extreme excitement. I think your approach is incredibly important to, again, develop some of the techniques now to quantify these issues and to really bring forward this important spotlight onto the health costs of climate change. And there's certainly many challenges related to that and to doing the kind of work you're doing. And I certainly appreciate the complexity of trying to drill down on the data and to work with fragmented data collection systems that are not easily accessible. So I really appreciate the work you're doing. I don't want to take a lot of time. I was able to ask questions in November, so I'd like to open it up to some of the questions that we have from our attendees. So let's see some of the questions here. I'm just going to go up to the top here. From Lisa Thompson, can you please explain why harmful algal blooms was associated with 11,000, I think it's 11,000 hospitalizations, 3 times more than ER visits, with a cost of $500 million?
Yeah, I can point you to, it was a 2014 study that we utilized for that harmful algal bloom analysis. And so that was really focusing on neurological impacts from exposure to HABs in Florida. And we combined that study with an estimate of the HAB prevalence from NOAA in that summer. 2012 was, I didn't mention, actually the hottest the country had ever experienced at that point. And there was actually a pretty severe HAB outbreak across Florida. I can point you to the underlying data in that study. I think I can say that we were pretty surprised by that huge number too. And so the study itself actually does point out we try to do a couple of sensitivity analyses around each of those that we could, given the available data. And so that'll point you to some more nuanced details on that case study.
And there was a follow-up question. Were you able to look at states that signed on to the AACA and any impact on mortality and morbidity related to climate change?
Oh, that's a great question. We did not look at Affordable Care Act statewide and what that would have meant in terms of morbidity and mortality. I think that's a fantastic avenue for future work. I saw a related question on Medicare for All. And so I think one point that I wanted to make is that it comes to these big government sponsored insurance programs, in one way or another, we're all going to pay for this problem. And certainly, we can either invest and make smart investments and divert our tremendous subsidies in fossil fuels to investments in climate change mitigation and adaptation, or we can all pay for unprecedented health costs when it comes to these climate sensitive events. So I think you've raised some great points in terms of avenues to consider when it comes to expected payers, and I'll definitely take that back to our team.
Okay, and thank you for a great presentation from you, Madison. Did you get a chance to look at health inequities by income along the same lines here in terms of social identities, race, gender?
Yeah, unfortunately, the data that we had access to really didn't allow us to disaggregate by income or race or gender. That certainly is a topic of interest to us, but unfortunately, in doing this national analysis, we lacked consistent data across the case studies in order to be able to do that. Certainly, I think something that the current situation is pointing out is the need for transparent release of as much granular, detailed health information as possible. Because right now we're understanding huge disparities in health impacts from the current situation, and I think there's certainly an analogy to climate change and the need to highlight particular risks for vulnerable communities. But unfortunately, we weren't able to do that in this study.
Okay, and what can be done at the national level to improve coordination between agencies, and who can take the lead on this? Really important question.
That's a great question. I think right now we have seen, of course, nationally, our federal government deny and censor climate change from any corner of action that it possibly can. I think, I see a role for CDC, especially to expand its climate and health work in a significant way, especially if we have a different direction when it comes to federal leadership. I think CDC is well positioned given their environmental public health tracking network and their robust but small, relatively limited work on climate and health to advance in the space. I also think that EPA should be taking a stronger position when it comes to climate change and health. So many EPA rules when it comes to air pollution have great bearing on climate change, and certainly we've seen actions from the administration in recent years that they're aware of those connections and are trying to roll back rules in ways that will ultimately harm prospects for climate policy. So I see a stronger role for those two agencies, and really we need much more of a sustained effort across the federal science enterprise in order to better integrate what's happening. There's so much work happening in NOAA even that deals with human health that has very little link right now to CDC or EPA, and that's unfortunate. So we are definitely in touch with House Committee on Science, but also with specific agencies themselves in order to try to enable a more efficient partnership amongst all of these different groups within the federal government.
Okay. There's a question about endeavoring to look at costs of time for any of these fires, lung damage, for example. I'm not sure I understand that question.
Oh,
Cost of time.
we did try to account for the length of stay associated with each of these harms. So for example, someone who, needed to deal with respiratory disease care in a hospital for a couple of days, we attached a dollar figure to the lost wages associated with that care. But that was really the only kind of time element captured in this study.
And there's a question about explaining extreme weather. Does it include flooding? And again, I'll let you take that.
Oh, yeah.
It was clear that there were several different types of cases that you looked at, and flooding was one of them.
So for extreme weather, that Ohio case study, it did cover extreme flooding. It also covered new research on what are called combined sewer overflows in Ohio, which are basically a situation in which wastewater infrastructure isn't prepared to deal with these huge pulses of precipitation, and so we actually see contamination of water resources in those events. But then we also saw injuries associated with extreme storms, so some summer storms that actually triggered outdoor injuries, a few deaths associated with trees falling. There were some other emergency response data reported by Ohio state government related to extreme storms. So that was kind of our catch-all term, but the paper spells that out in a lot of detail in terms of what we captured for Ohio.
Okay. And we have a question on your current work, any current work being done to increase zoonotic diseases related to climate change. Will your organization and colleagues be doing some data analysis on COVID as case studies as they develop?
Yeah, that's a good question. I think that one point that we're making at NRDC is that when it comes to emerging infectious diseases, the science tells us that climate, could potentially worsen the situation on that front, and that basically we've seen an expansion and a fragmenting of human and natural systems and an interface in a way that we've really never seen before in civilization. And so that, we need to enact smarter policies when it comes to wildlife trade, but we also need smarter protections for forests, for example, so that we have less encroachment of human society upon these areas that can, sometimes foster profound infectious disease risk for humans. When it comes to COVID, I think our focus at NRDC is connecting the dots on the equity angle. We've seen that, for example, the Harvard study that was published last week pointed out that long-term exposure to air pollution was associated with higher mortality rates from the coronavirus. And that's not, terribly surprising given our understanding of the links between air pollution and lung disease, but the numbers were huge. I mean, we're talking about a signal that was 30 times stronger for coronavirus than for all-cause mortality. And so we're trying to make the point that it's outrageous that the federal government at this point would be rolling back, the clean car protections, the mercury protections today, refusing to lower the PM 2.5 air quality standard, 2 days ago. There's really this parade of unbelievable deregulation and reckless activity at EPA, even in just the last month, that contributes to air quality problems that worsen underlying health status for millions of people. And so that's sort of the angle that NRDC is taking right now. We don't want to insert ourselves into this situation, but certainly we want to shine a light on the health disparities that are, horrifically visible at this point.
Okay. And I think we have a couple more questions here. Again, important connecting the surveillance system and tracking related to climate health impacts with the need to strengthen our existing surveillance systems, which are woefully lacking at this point.
Yeah, I mean, our surveillance systems right now, unfortunately, are on a fairly voluntary basis when it comes to the state participation in the tracking network. So certainly we see a need for example, the federal government to compel the state health departments to report their data to the CDC. And, in some ways, I think the current situation is helpful in showing the power of data to inform decision making. When it's done in a timely and transparent way, it can be really useful for policymakers and planning. But right now we have a voluntary participation system, and that patchwork, unfortunately, is leaving us well behind where we need to be in terms of planning and preparedness.
Over years, costs over time. I'm not quite sure what that is referring to. I guess going beyond the case study of the 1 year at a longer time frame.
Yeah. One idea we've floated is like sort of looking at a national, like, year after year compendium, kind of in a parallel effort to NOAA. The data don't quite allow for that, unfortunately. But that is something that we've pitched for the federal government to certainly consider. And especially if we have new leadership, maybe that's something that could happen, sooner rather than later.
Mm-hmm. And there's a question about linking numbers to economic losses from climate change in addition to health costs. So, for example, during the algal blooms and red tide, the beaches were closed and tourism and other things were affected. I think that might be on the direct cost.
Yeah, we are trying to connect this like health component to the other discussions of economic damage associated with climate change. So certainly, we're trying to tell the story in Florida or in Wisconsin or in California that climate change represents real dollars and real suffering and real expense when it comes to lost, tourism, when it comes to lost recreation, when it comes to human health. So certainly we're trying to connect the dots and really tell climate change in more human terms into the future.
Okay, I see we're running out of time. We're almost down to the last question. So just quickly, if you've heard, health metrics and evaluation will include climate change as an environmental risk factor in the global burden of disease estimates.
Yeah, that's a good question.
Not a quick
Yeah, IHME, they capture, some of these risks in terms of like air pollution and extreme heat, but unfortunately they don't, capture the full menu. But that's something I'll take note of and follow up with them. We're in contact with them.
Okay. And just there was a comment that they were surprised that air pollution showed such a low burden since we know how many systems it affects. Health systems,
Yeah,
organ systems.
right. Yeah, we focused just on ozone and just in one state because we wanted to make the climate link really clear. So certainly, if we had captured PM 2.5 soot air pollution, the numbers would have skyrocketed. But for now, we just focused on ozone since the climate link is strongest.
Okay. All right. Thank you so much for your time, Dr. Limaye. And certainly with the pandemic, with COVID, we've really seen the lack of preparation, lack of investment in our healthcare systems, and this additional health burden on the healthcare systems is certainly a huge concern. So there's plenty more to be done to shed more light on how these are all connected and to move forward the discussion. So thank you so much for your time, and I will wrap up here.
Great. Thank you all, and thank you for all of your work.
It's an excellent presentation. Thank you.